Here at SEQ Dental Specialist, we often have patients asking about suction dentures and how they compare to other types of dentures. I've taken this opportunity to video Prosthodontist Dr. Florian Mack as he explains in more detail about suction dentures.
Can you explain what is a suction denture?
A suction denture is a full upper or a full lower denture made with special impression techniques, focusing on getting the most retention in the mouth.
Okay. How long has this been around?
This has been developed by Dr. Abe. He is a professor in Japan and he developed this technique in 1998 and it's been consistently further developed over the years. He's got a lot of interesting students and there are a few people in Australia who provide those suction denture techniques.
So you mentioned retention. Just how hard is it to get good retention in the mouth of this denture?
It's hard to predict how hard you can get the retention. But for the upper jaw, it's always very easy to get retention. Why is that? Because simply the upper jaw's got much more surface, so it's easy to get suction or retention on a larger surface. The challenge for us is working on the lower jaw. So we talk about the mandibular suction denture. Because we've got a very small little tiny surface, we've got to be absolutely precise in our impression technique, bite registration technique, but also the way we're going to set up our teeth to maintain stability on the lower denture. And then usually on a successful suction denture, you need quite some force to get it out of the position.
But it's easy for me to remove when I want it.
You can take it out and you develop some techniques, to take it out yourself, but sometimes we see patients struggling taking it out. That's a great suction. It's not always the case, but in many cases, yeah, we get significantly way more suction than to the conventional denture.
Well, I think I'd rather it not falling out, so that sounds like a good thing.
It's a good alternative if you consider you're probably not suitable for implants or you don't have enough bone or you've got, you just want to stick with the conventional denture, There are different techniques on the market. Yes, the implants work as well, but as I mentioned, some patients are not suitable for implants, so why not trying the suction denture technique?
Yeah. So is it something that is a specialist procedure? I don't hear it mentioned very often.
You definitely need specialty training, and Dr. Abe and his team provides this training worldwide, and I was able to join one of his treatments and courses, and it's very, very exciting. It's a technique that's been developed way earlier, and Dr. Abe put it on a new level with different technology, different materials, impression materials, but also new bite registration materials, and that makes it much superior to the conventional denture technique that's been used by many dentists and prosthodontists.
Today's impression materials have changed, as modern impression materials have 3 or more different consistencies or viscosities. This has allowed a specific layering technique, which is required for the suction denture technique. The impression for a new denture should be made in layers. In the first step, the focus is on the border of the denture, and in the second step, the focus is on the impression of the overall mucosa, the frenula, and other anatomical structures. Ideally, this will result in a suction type denture.
What's the process? How do I go about getting this all started?
The best way to start is book a consultation with us, and I will examine your mouth, your mucosa, your ligaments, and I'm going to tell you what type of denture would be best for you. If you've got no teeth at all, we can definitely discuss suction dentures. If there are any teeth left, we can talk about different types of dentures.
As with any dental procedure, it is important to gravitate to those with not only qualifications, but a specialist in the field with lots of experience. Prosthodontist Dr. Florian Mack is that person, and highly skilled for all dentures, telescopic or suctioned, minor oral surgery, TMJ dysfunction, and all cosmetic dentistry. Give us a call. We'd be delighted to speak with you.